And we're here with Jim Johnson. He's the CEO of Region 10. Thank you for joining us, Jim.
Thanks for having me.
First of all, what is Region 10? Explain what the regions are in the state.
Region 10 is, we're a prepaid inpatient health plan, which means we are the governmental managed care organization for Michigan's Medicaid behavioral health plans. Michigan, in devising their Medicaid behavioral health benefit plan, broke the state into 10 regions. So based on population. So the regions are very different sizes geographically, but the population base is similar. So kind of like Wayne County is a single county region. Region 10 actually consists of St. Clair County, Sanilac County, Lapeer County, and Genesee County.
And what is the substance abuse? Are there many substance abuse issues in the Region 10 as there are?
Absolutely. We have similar substance use issues to the rest of the state, although we do have relatively high rates of opioid overdose compared to the rest of the state, and especially in Genesee and St. Clair counties. And one of the things with St. Clair County is where I-94 and I-69 both end. Mm-hmm. So we're also within an hour of Flint and within an hour of Detroit. So we get a lot of traffic that comes that way, and then it's, as I said, those highways end, and there's the bridge to Canada. So we get a lot of residual drug traffic. And
why do you think we're seeing such an increase right now in opioid overdoses and heroin use, actually?
Well, part of the issue with the opioid overdoses, obviously, is the presence of fentanyl, and the not knowing just how much fentanyl is in the heroin that folks are using. And it's a very dangerous substance for humans. The opioid epidemic, it just became, in part, that it became too easy to get to, I think. Heroin, the quality of heroin, if you refer to it that way, has improved over the years. And their market has spread. It used to be such an inner city phenomenon when you talked about people who were addicted to heroin. But over the last 20 years or so, it has been, soccer moms. It has been that other population that heroin is easy to get to. It's much cleaner than it used to be. And it's everywhere. It's not an inner city issue.
So you mentioned fentanyl. So is it getting mixed into the heroin then?
Yes, and it's just a dangerous tranquilizer, and it leads to the overdose. When folks overdose from opioids, the main health issue, the reason it's so dangerous, is that it slows their breathing and actually stops their breathing. So, and the more fentanyl that's mixed into the heroin, the more likely that is to happen.
So are you entering into a partnership with Meridian Healthcare Services?
Well, actually, we've been in a partnership with Meridian. We have a very good partnership with them. We've been involved with them for many years. What we're trying to do, though, is bring them closer to us. One of the things that we have in St. Clair County, we have a decent-sized population and a significant need for SUD services, but we don't have any intensive SUD services that are actually located in St. Clair County. So when we have somebody who needs, for instance, an opioid treatment program, and they may need methadone, they cannot get that in St. Clair County. We're sending them to, we can send them to Waterford, we can send them to Macomb County, we can send them to Genesee County, but they can't get it locally. And in the beginning, when you're starting that type of treatment program, they're doing daily dosing. And so when you talk about somebody having to get from St. Clair or Sanilac or Lapeer County to Macomb County, and maybe the closest place, every day, it's a huge barrier to treatment. You see folks who just don't make it through. They don't have the resources to get there. It's just an added barrier to access.
Why is that? Why is it not available?
Well, for a long time, there's been a lot of stigma around, especially, methadone and opioid treatment centers. There's even stigma within the law enforcement community, because methadone is an opioid. So there are some folks who believe you're replacing one with another. We know that really it's a great harm reduction strategy, and it is for many people a gateway to recovery, to full recovery. But still there is stigma, and the places, they usually tended to be in higher urban traffic areas, and that's still for the most part the case, or associated with a residential program.
So in terms of getting that kind of treatment there, that's where Meridian Healthcare Services will that's where we're hoping to move into there, in that area?
Yes, and we've known for a long time that that was an issue, but we began pulling data, for instance, from a couple years ago. We spent about $2 million on treatment for substance use disorders for citizens of St. Clair County a couple years ago. And we spent about 60% of that money out of the county because there were no providers locally. If you take, Genesee County is by far our largest county in the region, and they are about 2/3 of our Medicaid population. But if you take the other three counties combined, about 50% of the folks who need SUD treatment are located in the Port Huron area, and about 75% are located in St. Clair County. So it's a significant number for us. And so we did a request for proposals last year, and it was very specific in that we wanted to bring an opioid treatment program to Port Huron, to that Port Huron area. And we have a municipality there that's supportive of it. So where you have a lot of stigma in many places saying, the not in my backyard type of approach, we actually had a city manager who was saying, we need something here for our residents, for, to make it more accessible. We need to be more active and assertive in tackling the SUD problems in St. Clair County.
And in terms of, are you having any success with that and moving forward?
Well, we are. We had a number of providers that submitted proposals to that request for proposals, and Meridian's was superior to the rest. And so we're really just anxious now to be able to, have them, bring that to Port Huron. I know they're in the process of identifying the best space. And of course, there's a lot that goes into setting up an opioid treatment program with, there's, aside from the state licensure, you also have to have a special license to provide methadone. So there are some hoops to jump through, but I think if we can have that happen in the near future, it's going to be a great benefit to the whole region. Well,
it would also employ many people as well, correct?
Yes, it would employ many people at the setting, but it would also make many of the citizens of Port Huron more employable. So that's another issue we have. There's a small, industrial area there, and they actually have trouble hiring. But we have folks who, if they can, get into recovery and have some stability in recovery, we then, we grow the workforce.
So particularly, we've seen a huge increase in overdoses across the state and across the country. How has it affected Region 10? And we also just want to talk a little bit about the frontline workers that.
So the overdoses, really combined with the pandemic itself, have changed a lot of things about the way our provider network functions and the way we function. As a manager of care, it's changed for us the way we are able to monitor and support our network, especially a region like us where a good part of our network is actually outside the region physically, geographically. So the bigger change, though, has really been in our provider network. So we've seen a couple things really that have been very innovative and very useful. So the use of telehealth to address substance use disorders has shown us that there are some folks who actually respond better to that approach. We have providers who are showing us that they are able to engage folks and keep them engaged longer using some of that technology than they were experiencing with walk-ins and with in-person services. We know that's not better for everybody, and we know there are some types of treatment that you obviously cannot do that way. But for some folks, the pandemic has actually forced our network to develop a little bit differently. So we think coming out of the pandemic, if we're allowed to keep using that type of technology, the network will actually be stronger. More significantly, though, is we've seen a lot of our network providers really step up and do everything possible to make sure that treatment services remain accessible to the folks who really need them. So you see a lot of those frontline workers who are going above and beyond to make sure that the facilities stay clean and that they're doing the appropriate health screens for people coming in, and they're maintaining social distancing and all those other protocols that are in place to keep folks safe. And then when you get programs that have more intensive services, a residential program for instance, they've really changed the way they've done business. The amount of maintenance and cleaning and stuff that has to go on and the way they deal with someone who's COVID positive. So we have providers who, instead of refusing to accept folks who are COVID positive, they've changed the way they do business to accommodate folks who are COVID positive. We've had a provider, for instance, who set up a COVID positive recovery home. So, and it was just to deal with only folks who were tested COVID positive or were exposed, and they could be in that recovery home, and other folks could stay safe, and they could still, have that resource.
In getting the medications that you need in St. Clair County, how important is that going forward?
That's critical for us and for the folks in St. Clair County and really all across our region who are trying to recover. The barrier that distance puts in place is incredible. Not only in the folks who start treatment and have difficulty maintaining themselves in treatment, but it also is a barrier to people starting in the first place. It just becomes insurmountable for someone who lives, an hour and a half away from an opioid treatment program to think they're going to get there every day at that point in their life, at the point in life where they need methadone. It's not when you're at your best and your strongest. So it's an incredible event for us. We're looking forward to actually having that up and functioning, and we think it's going to be a huge benefit for Region 10. If you or anybody you know are struggling with substance use disorders or mental health problems, you can always call our Region 10 Access Center at 888-225-4447. And even for those who aren't eligible for the public behavioral health program, everybody will get referred somewhere.